Hello everyone! Welcome to the continuation of our discussion about the integral components of client care. We started with asepsis and prevention of infection. Now, let's discuss safety. For the learning outcomes, discuss the factors that affect the individual's ability to protect themselves from injury. Describe the methods to assess a client's risk for injury. Enumerate safety hazards throughout lifespan. Enumerate risk factors and preventive measures for fall. Identify measures to seizure precautions. So again, at the end of our discussion, here are the learning outcomes that the students can achieve. So preventing injuries and assisting the injured actually is part of providing safety to our client. So we have the common causes of injury and death, and they are motor vehicle crashes, falls, also fire and burns, poisoning as well. So nurses need to be aware of what constitutes a safe environment and how to prevent possible causes of injury. Okay, so we have several factors, alright, affecting clients' safety. Let's have first the following. Okay, so these factors include age and development, lifestyle, mobility status, health status, sensory perceptual alterations, cognitive awareness, emotional state, ability to communicate, safety awareness, and environmental factors. So let's see what about the age and development. Take note again that we have the very young and the very old individuals. So very young children only actually have knowledge and experience that they can learn about what is potentially harmful. However, for the very old individuals, they have difficulty with movements and diminished sensory neurologic functions, okay, which can cause injury. So take note again of the age, okay? Now we have selected safety hazards throughout lifespan. So we have for developing fetus, the exposure to maternal smoking, alcohol consumption, addictive drugs, and x-rays, especially during the first trimester, could affect the safety of the developing fetus. Next, we have for the newborns and infants, falling or falls, okay, suffocation when enlarged in cords, and choking, ingested object, crib injuries, and burns are common hazards for newborns and infants. How about the toddlers? Okay, so have you seen toddlers? Toddlers are children who are very active. So they most of the time run into objects. They can also be curious of many things that again be careful of the exposing harmful substances that can cause poisoning and also burns. How about preschoolers? Preschoolers are also active children. They're fond of playing, okay? So most of the time, they get injury from traffic or playground. They can also have suffocation. How about adolescents? Okay, so adolescents are, after fun. So they like fun, they go out with their peers. Most of the time, they encounter vehicular crashes. Also, there are recreational injuries. Okay, also involved in firearms. How about older adults? So these are the senior citizens. So they have again the possibility to experience fall, burns, Okay, because they have diminished senses, so sometimes they don't actually recognize or notice that the surface is already hot. Okay, and for all they know, they already get burned. Next, pedestrian and automobiles. So they actually can get accidents as they walk through the pedestrian lane, and again they can be hurt by automobile. So these are the hazards. Okay. You also have here lifestyle. Okay, so do you have unsafe work? What's the home environment? How are you working from home? Okay, how about access to firearms, illicit drugs, insufficient funds? Okay, so these are lifestyle related, because if you've got insufficient funds, and sometimes health can be compromised. We have here the mobility and health status. So alterations such as paralysis, muscle weakness, and diminished balance. Okay, so there's also spinal cord injuries, impaired mobilities as in hemiplegia or leg cast. Okay, weakened level of alertness. So again, this can compromise or predispose the client to fall or poor balance. Next, you have the sensory perceptual alteration. So, accurate sensory perception of environmental stimuli is vital to your safety or to the client's safety. Remember that people with impaired touch perception, hearing, taste, smell, or vision are highly susceptible to injury. Okay, how about cognitive awareness? Clients with impaired awareness include individuals who lack sleep, unconscious, and disoriented, and may not understand where they are, what to do. Okay, so they are wandering in a state of confusion. So, again, take note of these people. So, there should be mindfulness. Next is emotional state. So, this can alter the ability, again, to perceive environmental hazards. So, like, for example, if you're not feeling well emotionally, you're under stress, so there's depression, sadness, feeling of being alone. So, if you are in this state, you are not mindful of where you are going, then you are increasing yourself to the possibility of getting injured. So, another one is safety awareness. So, clients in unfamiliar environment, okay, for example, they are new patients, okay, and they are not familiar of their room, okay, and unfamiliarity of the environment, take note, frequently needs specific safety information. So in the area, actually, for newly admitted conscious patients, the nurse explains things, okay, or the layout in the hospital rooms, like where to find even where to find the remote control, where's the television set. Okay, so the being careful of the IV stand, where of course the IV infusion line is connected, and where the toilet is, and also will be instructing as well the significant other or the bantay, okay, to help the client. Okay, because again, unfamiliarity of equipment, substances can lead to injury. Okay, we have the environmental factors. So here, clients, as mentioned to you, is client safety is affected by the healthcare setting. So the nurse must be able to assess the environment of the workplace, home, or community for its safety. In healthcare setting, check for diagnostic errors, often unintended, okay? Like that of making use of machines. Sometimes it gets some errors, okay? And of course, it's not intended. So you also have establishing a culture of safety. So again, if there is safe work environment, especially in the hospital, then the nurse cannot commit any error and it will not affect the safety of the client. So there will be no domino effect. How about for workplace? There are nurses working in industries, in corporate setup, in companies. They are called the company nurses. Okay, so these are occupational health nurses. Okay, so take note that again, there must be safety of the machinery, of the chemicals in the area. Also take note of those individuals or employees who are already tired. Again, if they are already tired, they must take a rest for quite a while to regain their energy. Okay, also take note of the effect to one's health of having noisy environment, and also being exposed to air pollution. So if you are at home, okay, so make sure that you are going to instruct. For example, in what instances do nurses stay home or look after the client at home? It is when you conduct home visit, okay? So if you conduct home visit, you will be checking several factors or variables that is going to be critical of the client's safety. So check if the flooring is well maintained, okay, there's non-skid bathtub, mats, showers, safety again. Planning is there. Are there any alarms? Okay. How about in the community? If, for example, you are a community health nurse or you are now going to have the subject of community health nursing. So as a student nurse, you're going to assess the community. So have you seen proper functioning of street lights? Again, if the street lights are not functioning, it's broken, then the safety of the people in the community at night, okay, will be at stake. How about their water? Okay, is there safe water for drinking? Is there sewage treatment to clean the sewage? Those waste, water pollution causing materials, okay, can again affect the health of the people. So there is also regulation of food sanitation in the community that you have to take note. You have another one, disaster planning. So disaster planning occurs in the community, and nurses caring they care for the clients, then they also care for themselves. So in the Philippines, okay, disaster planning is handled by the local government unit, okay? Remember, whenever there's typhoon, the local government unit, for example, of Marikina is observing the level of water, okay, in the Marikina River. The same thing with other towns, other municipalities that they have their disaster control management committee, okay, and also they deploy nurses in acute care facilities. It could be ambulatory care facilities, in hospitals, which is referred to as long-term care facilities, or community agencies where they can help um, the individuals or people in the community affected by the disaster. Okay. So, as part of the nursing process, let's have now the discussion about assessment. Okay. In doing so, okay, for the safety, we assess. Okay. Take note of finding out the history and physical examination. In the area, you make use of risk assessment tools. So, this is actually a specific or general safety risk tool being used in the area. And also, you have to check, are there hazards, okay, present at home that can predispose them to fall, fire, poisoning, suffocation, okay? Next, we have national patient safety goals. So, according to the IOM's report, to err is human, okay? So, again, there should be increased awareness on the need to improve client safety. So, your goal would be to reduce harm associated with clinical alarm systems, high risk of injury if alarms silenced, okay, turned off or ignored. So, don't ignore the alarms, okay? For the disaster, as an individual, of course, we must be very familiar of who's the one in charge giving command, who's the one in authority. And as a nurse, okay, part of our health teaching to the client is to inform them about the one authorized to give command when there's disaster. So, always give them the phone number and other steps to take as well when doing or when actually preparing for disaster. We don't want any disasters to happen, but it pays to be prepared. So, also know the organization's disaster response plan. So, like that of the National Disaster Risk Reduction and Management Council, they actually give us a text message, right, about the disaster, like the level of flood, typhoon, presence, again, any signal or warning about earthquake, and so on. So, part also of your assessment is knowing their awareness about the NDRRMC. Now, you now have the diagnosing. Okay, so what could be the possible diagnosis? Potential for falls, infection, suffocation, poisoning, suicide. And for accident prevention, again, address the lack of knowledge. And for also the willingness of the individual to enhance their knowledge. And then when we do plan of care, okay, we look forward to the desired outcomes associated with prevention of injury. It could either be, of course, because of change of health behavior, also manifested by the modified environment, and particular outcomes depend on the individual's safety. So, for the implementation, okay, we must promote safety across the lifespan. Observation or prediction of potentially harmful situations in order to avoid harm. Provide client health teaching that can empower the clients to protect themselves and their families from injury. Okay, and make sure to focus on age groups, ha? So, for example, you make, for age-focused groups, take note of the newborn and infants. So, accidents are the leading cause of death. Parents, okay, must be taught of knowing the level of observation to maintain safety. They should not be complacent when leaving their children. And they should also be familiar in identifying and, of course, being able to remove common hazards. Of course, they must know first aid. So, teach the parents or significant others on how to conduct simple the simplest first aid. So, like that of CPR, or how to provide care for cases where there's airway obstruction to the infant. So, common accidents like burns, suffocation or choking, especially when the mother is breastfeeding. So, you must teach them how to properly call that burp the newborn, or getting releasing the gas. Okay, so putting the the infant or newborn in an upright position to the mother's breast. Okay. Next, of course, falls, poisoning. So, how are you going to do that? So, again, that's going to be part of your health teaching. And another one, how about for the toddlers who are makulit? Okay, so we have to do toddler proofing home. So, prevent physical trauma from falling, banging into objects, running into objects, getting cut by sharp objects. So, use federally approved car restraints, or those recommended by our government. So, also remove or secure potentially hazardous items like small or bits of toys, okay? So, also inspect first the quality of the toys. If it has lead paint, and if the lead is chipping off, then discard that one. So, also fumes from leaded gasoline, then, or any leaded substances, you make sure that they are away from those substances which can lead to poisoning. How about the preschoolers? Preschoolers are also makulit in another sense. They are active, okay? They are curious about so many things. They keep on asking why and why and why. And control of environment must continue. So, for example, here you can see in the illustration, the girl just slipped, okay? Maybe again she does not know what this sign mean, okay? Or maybe she's curious if she's going to fall. And so again, if the parents is able to watch or provide surveillance or check on their children, then this will not happen. So another one is to keep matches, medicines, other hazardous, okay, out of reach. So another one is we must already teach them how to cross the street. Of course, they are not allowed to cross the street by themselves. So remember that these preschoolers are curious, okay? So take advantage of that curiosity. Provide knowledge, provide information. Okay, so when you teach them how to cross the street, teach them how to recognize the go sign, go signal signs, red and yellow, and so on. So what else? Okay, you can also teach them to ride bicycles and other wheeled toys. Okay, but make sure that you are with them. Okay, so again, proper guidance is important. You must emphasize that to the parents or significant others. How about the school-age children? So, school-age children engage in fantasy, in magical thinking. They are actually now imitating their parents or superheroes if they're fond of that. So, the leading cause of death is accidental injury. Okay, so we must be careful when we do actions in front of our children. We must instruct the parents to be careful of that, to emphasize the need to tell the children that it's not allowed, only mom and dad or adults can do this one, okay, and tell them the consequences. Otherwise, they might imitate you. Okay, so emphasize on that health teaching. So, most frequent causes of death, motor vehicle crashes, drowning, fires, firearms. Minor injuries brought by swings, okay, in the playground, bicycles, skateboard, swimming pool, like drowning. Okay, so take note of that. Next, you have safety again among adolescents. So, adolescents are actually, conscious, but then they can also, of course, need health teaching from us. So, during adolescent period, most of the cases are because of suicide and homicide. So, these are two leading causes of death. And your health teaching about emotional support, of course, your assessment, that's very helpful. So, the influencing factors for this kind of, instances is because of economic deprivation, lack of financial stability, there's becoming peer pressure, of course, and there's no financial stability. And then family breakup, okay, and there's also availability of firearms, and let's add up drugs, okay, so there. For young adults, the leading cause or causes of death is about motor vehicle crashes, suicide as well. So here, take note that again you provide health teaching that can again warn the young adults to not operate any cell phone, any gadgets while driving, okay, and then also we have to be emphasizing their patience when there's traffic, okay. There also physical complaints, body aches, okay, also decrease in social and work roles, sometimes that this happens. So, young adults can also be into suicide, especially if they did not or they get frustrated of achieving their dreams in terms of their career path. How about the middle-aged adults? Okay, so they are also in accidental death, the same of that young adults. So motor vehicle crashes are common, decreased reaction time, okay, decreased visual acuity as well. Also, there's fall, burns, again, because of the diminishing or the decrease in visual acuity. So, accidental death can be due to drowning, poisoning, safety hazard, those who are working in hazardous areas or corporates, okay, take note of the importance of giving health teaching about prevention of occupational injuries. How about older adults? Older adults, again, if they were into driving before, okay, this time night driving becomes a challenge. Okay, so accommodation to light gets impaired, peripheral vision, okay, diminished. Driving in fog, okay, so zero visibility should be avoided. So, fires can also be, again, a factor. So, we must tell them, okay, health teachings, okay, to warn them of not forgetting the iron or stove being left on. And then, they extinguishing a cigarette completely must be, again, reminded. Potential for burns when person bathe using heat device okay, equipment. Another one, individuals who are risk for wandering. What else? Again, they might be predisposed to what? To automobile crashes, okay? another or accidents, another one taking or using analgesic and sedative. So also in some instances where they really get depressed, okay, and feel alone, they commit suicide. So again, provide health teaching about prevention of this. Okay, next we have implementing safety across the lifespan where there is domestic violence. It could either be affecting the children, it could be the spouse, okay, or older adult abuse. So nurses here becomes the advocate for community support programs. In the Philippines, we have the DSWD, okay, to support this kind of violences. Okay, another one, you have to avoid focusing on blaming, okay? In order for you to promote safety in the healthcare setting. So, you must be able to develop trust, and then you share experiences about safety with your colleagues. So, be active in preventing medication errors, and always take note that communication is important to avoid errors. Okay, how do we actually prevent specific hazards like falls? So, for infants and older adults, particularly those who are prone to accidents, okay, to falls. So, again, we provide health teaching. So, in the hospital, okay, what do? You raise the side rails. So actually, the Joint Commission standards will assess, manage clients' risk for falls, and implement interventions based on the risk. Another one is in healthcare agencies, you must orient the client's surroundings and explain the call system. Carefully assess the client's ability to ambulate, okay, and transfer. Provide walking aids such as a crutch, okay, and assist the client as needed. Closely supervise clients at risk for falls, especially at night. And encourage the client to use the call bell as mentioned in here, the call system, okay? And then place the bedside tables and overbed tables near the bed or chair so that the client will not overreach. Okay, if you are in the hospital, again, take note, nurses or student nurses, that you must always um, keep the hospital beds in low position with wheels locked when not providing, or especially when not around, okay, so that the clients can move in and out of the bed easily. Encourage the client to use grab bars, okay, and these are mounted in toilet and bathing areas and railings or along corridors. Make sure that non-skid bath mats are available in tubs and showers, again, so that they won't get slipped. Encourage the clients to wear non-skid footwear. Keep the environment tidy, okay, especially light cords out from the underfoot and furniture out of walkways. Use electronic safety monitoring devices rather than side rails for confused client. Okay, so electric operated devices. And use mechanical ceiling lift to transfer dependent clients. Okay, so we have preventing specific hazards such as that of seizures. So, when there's partial, there's electric discharges from one area of the brain. So that's partial. So it's just the aura or occurrence will just be quick. Okay? Generalized, a seizure will affect the whole brain. Okay, grand mal will involve the entire body. So take precautions to prevent client from injury. Again, always be aware of the client's history. Okay, and also that you provide health teaching to the significant others or the relative on how they are going to manage this condition of their relative. Okay, next we have the scalds and burns. So take note that the common home hazards that causes scalds and burns, we have pot handles over edge of stove, electric appliances used to heat liquids or oils, dangling cords, excessively hot water. And in these instances, you must monitor clients with impaired skin sensitivity. Okay, we also have fires. So, agencies again must be known to the individuals. So, know the fire safety regulations and agencies' fire prevention practices. Also, take note of the acronym RACE and PASS. RACE, R, rescue, A, activate, C, confine, E, extinguish. Pass, P, pull, okay, A, aim, S, squeeze, and S, sweep. Okay, so that's for, these are the acronyms. Again, if they're for home fires, you teach fire safety. Keep the emergency numbers by telephone or in cell phone, okay? And then, also smoke alarms must be operable and appropriately located. So, also, batteries in smoke alarms annually on special day must be always checked. And then you can actually conduct a family fire drill. Okay? Fire extinguishers must be available and working. Close the windows and doors if possible. Okay, cover mouth and nose with damp cloth. Assume bent position with head as close to the floor as possible. So these are sample actions that you would teach the client. Okay, how about carbon monoxide poisoning? So this one, there's prolonged exposure that can lead to unconsciousness, brain damage or death. For example, you have left the car, okay? You've left it on, and then the gas emitted by that car, okay, gets into your home, and then you can inhale it, and then suddenly you feel dizzy, and later on you now actually get unconscious. There's an instance, okay, when a couple died where they stayed in a car turned on. Okay, they actually died because there was actually, it's controversial that they actually sneaked in. They are young adults. They sneaked in and left the car cover on the car, and there got intimate in the car, and for all they know, okay, they were found dead. It's because you know the the engine that releases the smoke, okay, it's covered by the car cover. So it's just the carbon monoxide just got trapped in the car, and they ignored the smell and still intimate about stuff. Then maybe they fell asleep, unconscious and died. So please don't do that. So there must also be detectors available for the home. Okay, another one is poisoning. So teach the parents to child-proof the environment. Provide information and counseling about insect or snake bites and drugs used for recreational purposes. So you must make sure that it's not poisonous. So for example, if for example the child touched the hand with this mosquito repellent and unknowingly ingested, okay, or put his hand into his mouth, then what will happen? Is there a possibility of poisoning? We don't know, okay? So that's very important that you have to inform the parents to read the label first, okay? So go for organic mosquito repellents. Safeguard the environment and monitor underlying problems to prevent accidental ingestion of toxic substances. How about excessive noise? Okay, so minimize noise in hospital setting. We actually do not want the clients or the patients to bring radios, okay? Provide, again, instruction to the client and the significant others. What else? Protect hearing as much as possible. Okay, so you also have to make sure that the physiological effects of noise, again, take note that it can increase the heart rate, respiratory rate, increase muscular activity, can also lead to nausea, hearing loss as well. Okay, so in minimizing the noise, okay, we can teach the clients on how to design the homes, okay, or and suggest acoustic tiles on ceilings, walls, floors, drapes, and carpeting can also help. Background music can help, okay, very slight. Okay. Another one, you have electric hazards. So, to prevent electric shock, current travels through the body to ground rather than specific electric wiring. So, here you must be aware of your surrounding. If there's already an incident, please don't go to that area. Okay? Instruct the client about that. And then, make sure, okay, nurses, that the equipment must be properly grounded. Always read the label, the instruction of the equipment that you're going to use. So also take note that faulty equipment means danger of electrical shock or fire. And then the client may sustain superficial or deep burns, muscle contractions, cardiac and respiratory arrest. Okay, you have here, take note to prevent electric hazards, use machines in good repair, wear shoes with rubber soles, stand on non-conductive floor as I've mentioned to you, use non-conductive gloves, do not touch the victim until electrical current turned off, or remove the victim from the contact. Firearms, okay. Instruct the parents to store all guns in sturdy locked cabinets without glass, okay, so that it will not catch any attention of the children. Make sure keys are not accessible to children. Store bullets in separate location, okay, so as not to try the guns. Tell the children to never touch the gun or stay in a friend's house where a gun is accessible. Teach children to never point the barrel of a gun at anyone or to themselves. Now, okay, how do we prevent? So, ensure the firearm is unloaded and the action open when handling it to someone, okay? Don't handle firearms while affected by alcohol, drugs of any kind, including pharmaceuticals. So when cleaning or dry firing a firearm, move all ammunition to another room. Okay? So, next is double check the firearm when entering the room that you use to clean the firearm. Double check. And then inspect the firearms regularly, at least every 2 years. Okay, next is radiation. So, when there's radiation, you limit your time near the source. So, like if, for example, you're going to have x-ray, so that time that the x-ray will be conducted to the client is limited enough for the radiation. And then, provide as much distance as possible from source. Okay, as I don't know if you have observed, but the rad techs are wearing shield devices. Okay, so be familiar with agency protocols. So, also here we've discussed disaster prevention, its mitigation, preparedness, response, and recovery. As to whom are we going to coordinate with, it's very important that you tell the clients. Okay. If there are procedure and equipment related accidents, you must first, okay, check the aspects to prevent the risk for accidents. So this is going to be part of the assessment. So also provide, if for example there has been an accident, consult written guidelines, make or submit an incident report as to what happened. Okay? Alright. Next, we have here restraining the clients. So, you can see in the image, here is an illustration on how to restrain. Excuse me. So, restrain means to protect or to apply protective devices that used to limit the physical activity of the client or a certain body part. The reasons for restraining could either be avoiding or preventing purposeful or accidental harm, okay, to restrain to the client, and then to do what is required to prevent medically necessary treatment that could not be provided because the client will resist, okay? So, that's the reason for restraining. Okay, so restraining can also be used to prevent the client from harming others. Physical restraining is any manual or physical or mechanical device or material attached to client's body. Okay, so these are actually the types. So, chemical restraint, you don't need any medical device. It's just medications that used to control socially disruptive behavior. Before using or restraining the client, take note of its legal implications, okay? Restraining will restrict the individual's freedom. And then, orders must always be renewed daily. Will the client be restrained today? Okay, always check. Orders must state the reason and time period. So, whenever necessary or PRN order, prohibited, restraints. Okay? And nurses must document that need for restraints. Okay? And that again, it was made clear to the client why is he being restrained, and also inform the family about it. Okay, so we have here, you need to understand, okay, or you need to let the client understand the purpose of restraining. So, now there are 5 criteria for restraining. Restrain client's movement as little as possible. It's safety for the particular client. And does restraining not interfere with client's treatment or health problem? Is the restraint readily changeable? Is it as discreet as possible? Okay, so check on those first before applying restraint or before restraining the client. So, the desired outcome here must reflect the knowledge about hazards, okay, behaviors that incorporate safety practices and skills to perform in event of emergency. So, take note that nurses' role here is largely educational or through health teaching. Okay, next is we have to describe the methods to prevent hazards. So, report the use of home safety measures, alter home environments to reduce the risk of injury, describe emergency procedures for poisoning and fire. Okay, so for the references, I have used again Fundamentals of Nursing by Cogier. Okay, so thank you for listening and please do listen again to the next topic which is about hygiene. Okay? Thank you. Maraming salamat po.